All right, case study number 1. We're going to let Lenny tell you about the IT band syndrome patient.
All right, so we did a functional screen on her and then did a neuromuscular assessment and found that she had a lot of glute and hamstring weakness. The problem was not actually her IT band. And then we did some exercises with her and she was feeling better afterwards. We then added some patient education into it and told her to stop foam rolling, or like rolling out on a ball and stretching, things like that, that she had no changes or honestly made it worse from.
Okay, so did we waste our time assessing the IT band?
No.
Did we waste our time giving her IT band focus things?
No.
Did we get to the root cause?
We did.
Was she better when she left?
She felt better, yeah.
Was she thrilled that she wasn't going to conventional physical therapy anymore?
Yes.
All right, case study number 2, our car accident, whiplash, low back pain patient.
All right, so we did a functional screen on this individual as well. He had a lot of spasticity that was causing him a lot of pain after his accident. And so we used the law of reciprocal inhibition and activated those opposing muscles so that he could improve his range of motion, and he was feeling a lot better at the end. Then we then gave him exercises once again to just encourage him to get out of that range of motion that he was sort of stuck in.
And did we tell him that he should cancel the chiropractor?
Yes, no more chiropractor.
Avoid the massage?
Avoid the massage.
And educated him as to why he should do that?
Yes.
And was he super thrilled that he didn't have to do that anymore?
Yeah, he was.
And did we focus on function?
Yes.
And that got rid of symptoms. All right, case study number 3, our lifter with low back pain.
All right, so during her movement analysis, we saw that she was making a lot of compensations. And so on the table, we saw which specific muscles were doing those compensations, so which were overactive and which were not activating. So we worked on facilitating those muscles and then had reinforcing exercises afterwards to replace the corrective exercises she was doing with traditional therapy.
So did we have her get rid of the mobility work?
Yeah.
And did we give her correctives or did we give her reinforcement exercises?
Reinforcement exercises.
Because we want to reinforce what we did here, because corrective exercises don't work. And now does she have an active range of motion, active warm up and cool down that she can use at the gym?
Yeah. Yep. Much more comfortable too.
Yep.